Welcome to Kenton's videos. Enjoy the video.
You begin by confirming the medication order and that enteral administration is appropriate. Once done, verify tube placement. Use pH testing or prior radiograph as required because wrong placement risks aspiration. Prepare each medication correctly. Choose liquid forms when available, crush solid meds to a fine powder and dissolve in 10-30 ml sterile water. Make sure drug compatibility with feeding formula is checked so you avoid clogging or reduced absorption. From here, you administer meds one at a time to prevent interactions and tube occlusion. First flush 15-30 ml sterile water, then deliver the prepared dose by gravity or gentle syringe push. You should feel smooth flow and not require force. Once a medication is delivered, flush another 15-30 ml to clear the tube and wait a minute between drugs to avoid mixing. Make sure you document volumes given and observe for coughing or discomfort because these signs indicate aspiration or misplacement and require immediate reassessment. You finish by flushing the tube with 30-60 ml sterile water to fully clear medication and prevent clogging. Then reconnect enteral feeding according to orders and document the administration. Monitor the patient for pain, coughing, nausea, or changes in vitals because these symptoms may signal complications. If you encounter resistance or no flow, do not force the syringe. Instead, try gentle small volume flushes, reposition the patient, or use an approved enzymatic declogger and notify pharmacy or the provider if obstruction persists.
Thanks for watching. Consider subscribing if we helped you.